Okay, good evening, everyone. This calls to order the regular Board of Health, Boulder County Board of Health meeting. The date is Monday, December 14th, and the time is now 5:31 p.m. First, start off by asking Board of Health members to announce themselves. This is Greg Thomas. I am the board president.
This is Jorge de Santiago, Vice President.
Morgan McMillan, board member.
Brooke Harrison, board member.
Good evening. Okay, Jeff, if you want to take the county staff, that would be great.
Jeff Sayak, Executive Director of Boulder County Public Health. And on the phone, we have Marielle Barron, we have Chris Campbell, we have Heather Crate, Sheila Davis, we have Ramona Farnow from the county. Thank you, Ramona, for joining us tonight. We have Tammy Golden, we have Indira Gujral, we have Megan Hatton, we have Kate Haywood from the County Attorney's Office, we have Kelly Hinch, we have Rita Mangan, we have Lexi Nolan. We also have Pat O'Rourke. Thank you, Pat, for joining us. You all met Pat before. He will be speaking tonight briefly. We also have Trina Rulin from the County Attorney's Office. And let me check and see if there's anybody else that's on that from our staff that I did not announce.
Jeff, this is Nadine. I'm here.
Thanks, Nadine. Nadine Bridges as well. Anybody else? All right, Greg, the floor is back to you.
Okay, well, we do have a quorum present, and so that's at least 3 board members, and we have 4 currently. So this regular meeting of the Boulder County Board of Health has been called to order at the discretion of the Boulder County Public Health Director, Jeff Zayak. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference phone number and conference ID, so members of the public can participate in this meeting. Due to the current COVID-19 pandemic and the need for social distancing and compliance with the public health order, this meeting is being held telephonically as authorized by the Boulder County Board of Health bylaws. Okay, so usually our first item on the agenda is public comment for any unscheduled agenda items. Do we have anybody on the phone or on the Teams meeting that is from the public and wishes to provide comment? Gone. Okay, looks like we have no public comment for tonight. And so with that, we will move to item 2, which is the consent agenda. And so the consent agenda consists of the 3 items you see here: the November 9th regular meeting minutes, the November 12th special meeting minutes, and the approval of the year-to-date financial statement. If there are no call-outs on any of those items, then we just need one motion to approve the entire consent agenda.
This is Morgan. I move to approve the consent agenda.
Second.
This is Land. A second, yes.
Okay, all in favor?
Aye.
Aye.
Okay, motion carries. Thank you very much. Item 3, which is several items actually, update on the current pandemic. Jeff.
So Greg, let me just do a quick kickoff here. So we've got 4 items under item 3. The first one is an update on the Public Health Order 2020-08-1 that is set to expire tomorrow. Just as a reminder, this order limits gatherings associated with kids between the ages of 18 to 22 years old in the city of Boulder. As you all might remember, we put this in place to deal with response to the outbreak of the 18 to 22-year-olds shortly after the University of Colorado folks came back. We're going to talk about this one first. Kate's going to kick it off and just remind you where we're at and why we're recommending letting this order expire. I can also wrap up on that. And at the end of this, what I'd like to do is just give Pat O'Rourke, who's on the phone, a chance to do a quick update relative to where the University of Colorado's plans are for coming back in the spring semester because it's related to us allowing this to expire. And then the second thing is an amendment and an extension of Public Health Order 2020-10. The third thing will be an update on COVID-19 from Chris Campbell, who's on the phone. And then last, I'll do a short update today. It's positive news on the latest trends of COVID-19 before we move into item 4. So at this point, I'll turn it over to Kate first, and then at the end, we'll turn it to Pat.
And actually, Jeff,
I'm sorry, I said Kate, and I meant Trina. I knew it. Right after I said that, I was like, it should have been Trina. Sorry about that.
It's okay,
Trina.
we're interchangeable. So Public Health Order 2020-08, and we amended it one time, was a public health order to address the CU surge. CU has gone fully remote, and I can't remember the exact date, but it was in mid-November. And Pat O'Rourke and the CU community announced that they will start remote again. So our recommendation with respect to this local public health order limiting gatherings for 18 to 22-year-olds, the mini dial and the levels that we referred to, is to not renew this public health order. And that's for a couple of reasons. First and foremost, CU will be going remote. And also with the state's new public health order, with the state's new dial, they have added this level purple. And the level red now does not allow for institutions of higher education, with very limited exceptions, to go in person as long as a county is in level red. So we believe the state's dial system makes a local public health order with any dial system unnecessary at this time. And I can let Pat speak further if there's questions about CU specifically.
So thanks, Trina. I think you hit the high points. We announced last week that we were planning to start the spring semester remotely. Earlier, we had communicated to our community that we would be resuming instruction around January 13th, and that would include some in-person instruction. Based upon what has happened in the county and across the state, we've made a decision that we will not resume in-person instruction until at the earliest February 15th. And all of that presupposes that we would have moved from level red to level orange on the COVID dial, based upon the experience that we want to be able to provide for our students, not just educationally, but also in terms of their social development. It's necessary for us to be able to get to the point where we're changing to a lower status on the dial in order to be able to do that. During the interim, we're continuing to support our community that has remained in Boulder, because we know that even when we're not in session or when we're in periods of remote instruction, that there are student members of the community who remain in Boulder. We're continuing to support that with our testing and contact tracing programs, as well as we continue to have isolation and quarantine space available. So we're continuing our operations in this remote environment to be able to support the needs of the CU community. We also expanded our testing, not just to reach our immediate faculty, students, and staff, but also to reach all of the family members of CU faculty and staff, to be able to help reduce the burden on the county's testing demands. And we're doing all of the contact tracing related to the testing we perform. So we think we're in a relatively good place at the moment. We would support the loosening or the termination of the order related to the 18 to 22-year-olds. We have seen that the disease incidence rates in that population are no longer the outlier that they were compared to the rest of the population, and that things seem to be more along the lines of the community statistics. And so in order to be able to minimize the amount of confusion in our community, we're committed to continuing safe public health practices, but the concerns that motivated the order seem to have abated somewhat. But I'd be happy to answer any questions you might have.
I just want to say thank you to Trina and Pat, and especially for board members. want you to see, I think this is at least the second time, if not the third time, that Pat has been here. I very much appreciate the partnership, commitment, relationship that we have with CU and the close working conditions, because we wouldn't be able to accomplish this if we weren't working together. So, Pat, thank you again for being here and being willing to open up and ask or answer questions of our board members. And board members, so we are recommending that we let this expire. Do you have any questions of us?
This is Landry. Is there a time when it might be revisited if anything changes in February? Can we put it on the agenda to just readdress when the school's open?
Yes, we can. And what we would do, I can actually share this with you real quick, because I can illustrate what we would look for to actually change what we're doing. So this is currently what our rates look like for each of the age groups. And what you can see here is this illustration when we had a high, it basically jumped right out of the line of where our normal case rates are with these other age groups. If we saw something like that happening again, especially as school comes back, as Trina said, we could pull this back into play pretty quickly, but we would want to be able to make sure that if we're going to justify an order that would focus just on a certain age group, that we actually have this age group significantly different than the rest of them. So that's when we would revisit pulling something like this back.
So, Jeff, do all these items require motions? And then I guess my question to the board members would be, do we want to get through all 4 of these items and then come back and vote on each of these? So I guess do we have to vote to let this expire, Jeff?
Trina, do you know the answer to that?
I think that'd be a best practice to vote to not renew or just let it expire. And just to put a fine point on it, voting to let it expire does not prohibit you from entering any future orders. We can always revisit at any time and tailor any future orders to the needs at that time.
So, and I believe in terms of your question, Greg, items 1 and 2 would require, maybe they don't require, but I would recommend that items 1 and 2, we actually have a motion and a vote on.
Yep. Okay. We can do them individually. I'm just curious if the board would rather get through the update and then come back and do the motions for the first 2 items.
We can jump into the update unless we hear otherwise.
Yeah, that will be great from my end.
And Jeff, we have one more public health order to talk about before we provide an update.
Yeah.
Okay,
So,
thanks.
Jeff, are you turning me loose?
Let's see if you all have questions for Pat before we turn him loose, because I don't want to keep him here. Thank you, Pat, for bringing that up.
This is Brooke, and I don't have any questions, but I agree with Landry. It might be nice to revisit this when the students come back to sort of see what we're going to do differently than we did in the fall.
Thanks. We can bring that back to the board at the January meeting, because that would be the time frame that's far enough in advance, and we would need to do that in partnership with the university.
I'd be happy to come back and do a briefing on our return to campus strategies when it's getting closer to when we'd be having people return from remote status.
Thanks, Pat.
Okay. Yeah, I'm good with that, Pat. And I don't envision there being any issue with the motion. I just think with this package, it's probably good to hear all of the items before we actually vote on them.
Understood. I will allow you to continue your meeting, but did want to also tell the board that the partnership that we've had with Boulder County Public Health has been truly extraordinary. Other higher education institutions around the state have looked to this partnership and asked us how we developed it. So I can't thank you enough for the support that you've given us and for Jeff and everybody else at BCPH how much it's meant to us to have a willing partner with whom we can be able to address concerns when they arise.
Yeah, agreed. You've been very present and forthcoming, so thank you, Pat.
Appreciate it.
Thank you,
Happy
Pat.
holidays.
Thanks, Pat.
You too.
Happy holidays.
Okay, Trina, do you want to take us into the second one?
Yes. So in mid-November, when we started experiencing another surge in cases that was independent of the CU surge, we passed Local Public Health Order 2020-10, which we talked to this board about as well. That did a couple of things. We passed this while we were still in level orange, so you have to keep that context in mind. But we limited indoor event capacity to 25 people. We limited indoor dining to 1 household. We prohibited spectators at certain sporting events, and we strongly recommended that all Boulder County employers have their employees work remotely. Since that order was entered in mid-November, Boulder County was moved to level red. The order expires on December 15th, I believe, tomorrow. Because we are in level red, most of the things in this order are moot because level red does not allow for it. For example, indoor events are not allowed at all in level red. Indoor dining is not allowed at all in level red. The spectators at sporting events is permitted outside in level red. And our order as it currently stands does prohibit them. So current status in Boulder County is that spectators at adult, high school, and professional events, including post-secondary events, are not allowed, although those football games themselves and other sporting events themselves are allowed. You just can't have spectators. The recommendation from Boulder County Public Health would be to amend and extend this order with respect to the outdoor spectators only. So it would effectively keep the status quo to amend this order for the foreseeable future. We have talked briefly with CDPHE about it, and it seems to be their preference that spectators are not allowed at sporting events for adults, post-secondary institutions, and high school sports.
And for board members, I just would like to add a little bit more. So one of the things that we know is really important as we move into the spring semester and before we have vaccine widely distributed is we know how important it is to keep kids in school. I just came from an 1.5-hour meeting with Heather, who is also on the phone with the school district. Their desire is to make sure that their kids can be in person as much as possible. And a lot of that is driven by what our community spread looks like, certainly for the secondary education level. So I just want to illustrate that we are consistent with what Adams County is still currently doing. And I believe Jeffco and Trina, you can correct me if I'm wrong. But we want to keep this consistent because we don't want to put at risk our school districts' ability to be back in person. Both of our districts support us in this as well. So I'll stop there.
And that is correct about our neighboring districts. They have similar orders prohibiting spectators for certain outdoor events.
So is this is Morgan, is this really about CU football? Is there anything else that falls into this category?
It's also about high school sports, which my understanding is there's not much happening right now. I'm not sure if the high school season is over yet for football. I think it might be. So it would also apply to high school sports, and it also applies to adult rec leagues. So you can have adult recreation, you just can't have a group of spectators standing around watching.
Have to be a pretty hot adult rec game going on.
Perhaps.
Great, thank you for clarifying.
Any other board questions?
Nope.
Okay, I think that's a great explanation. Thank you for keeping it simple, Trina. Okay, Jeff, do we want to talk about the vaccine distribution plan?
Well, do
Hey,
you
yeah,
want a
Greg?
motion?
Oh, yes.
Sorry. Yeah. I was going to say, before we get too far, it feels like now, I'll turn on now feels like a good time to vote on these, just so that we don't, otherwise I'm going to forget what's supposed to be
Okay,
moved.
sounds good. As long as you guys don't need to see any more information to make your decision, we're good. Okay, so let's revisit that first agenda item, letting the Public Health Order 2020-08-1 to expire.
I'll move to let the Public Health Order 2020-08-1 expire December 15th.
This is Brooke. I second.
Motion and a second. All in favor?
Aye.
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 Okay, that motion carries. And then on to item B.
This is Brooke, and I move that we amend and extend Public Health Order 2020-10.
This is Jorge, I second.
Okay, and then just for clarification, this is just to allow the prohibit spectators at sporting events. And the rest of it is goes by the wayside because of the, anyway, just to clarify that. So we have a motion and a second. All in favor?
Aye.
Okay, both motions carry. All right, now we can move on to our vaccine distribution plan.
All right, and I'm going to introduce, I know both Indira Gujral and Chris Campbell are on the phone. They've both been working really hard on this with other folks as well. But I just want to take a second to celebrate where we are today. This is really a monumental moment for us to think that we had a vaccine developed that's got close to 95% and over 95% effectiveness, and that we're distributing it in a period of time that was as short as it is, and it's safe and has authorization, is really quite an incredible feat. And when I was on a state call at 3 o'clock today, people were about in tears at this, because this really does represent a potential light at the end of the tunnel for us, depending on how many people do uptake on the vaccine. And it's pretty exciting. Our team, if you all had read the entire plan, it's over 50 pages about how we're going to distribute this vaccine. It requires a ton of coordination and close partnership with key folks in our community. It's going to take months for us to get this out. But we are in the first stages of this, and I'm just so proud of our staff for all they've done to pull this together and move it forward. So with that, I'll turn it over to Chris, who I believe is going to take the lead on this.
Thanks so much, Jeff. Give me a moment, folks. I'll make sure we get the presentation up here. It's always a question mark when you're doing this on Teams. So let's see here. If someone can let me know if they're seeing that, that'd be great.
I see it.
Okay, wonderful. Good evening, everyone. My name is Chris Campbell. Thanks so much. I'm the Emergency Management Coordinator with Boulder County Public Health, and I cannot thank you enough for letting us present this evening. And we're just going to jump right into the update. And Jeff, I really appreciate the introduction there. Just want to mention, and Jeff did frame it well, that this is certainly a light at the end of the tunnel, which is something to really celebrate. And I think our message in this group needs to understand, our message for the community right now really is patience. It's a remarkable time right now, and it's going to take a little while. We're going to see very limited vaccine in our county initially, and it's going to take a little while to work through this, to have the vaccine distribution ramp up and have it be available for Boulder County. So in the meantime, I think we all need to really continue to focus on those messages around, doing your part. So distancing, masking, limiting gatherings, particularly as we're going into additional holidays. So I just wanted to frame our conversation with that and mention that, although I also think that it's very important to celebrate where we're at. Just to let the group know, we have just an incredible group of with our core planning team in the county, and this includes emergency coordination expertise from the Longmont Office of Emergency Management, Boulder Office of Emergency Management, CU Division of Emergency Management. Our North Central Region Healthcare Coalition executive director there has been working right along with us and informing our planning. We also, just to mention, have been clearly coordinating with the staff, remarkable staff at the State Health Department with their immunization branch, and also on the emergency management side. So we wouldn't be where we're at thus far in our planning and really starting to distribute vaccine in Boulder County without that coordination and partnership. I also want to mention certainly Dr. Bina, our incredible epidemiologist, our internal immunization teams have been fully engaged in this planning effort. So I think this board and this group can feel really proud and strong the stance we have right now moving into this. It's really important to look at one of our main objectives early on was to monitor vaccine development and really with an eye on safety and the lens by which, particularly a health equity lens by which the vaccine development was going through. So we worked with regional partners and state partners to monitor that vaccine development and feel really good about that. And I think this board needs to know that I think we can feel strong about the rigor of the development of the vaccine. And what this slide shows is just the life cycle that this vaccine development, the several vaccines that are going to be available to us have been through. And it's great to know that. So we've certainly moved through clinical studies and clinical trials and gathered data on that. We've had an FDA review. We've had an independent advisory committee review. And ultimately, as you know and probably know, emergency use authorization for one vaccine and near EUA for another. And as part of this effort, certainly we're going to continue to monitor safety, monitor any kind of impact on our community members as they start to access vaccine. So, as you all probably know, the Pfizer vaccine has received emergency use authorization, and Moderna is expected to receive EUA emergency use authorization. Both vaccines were tested in tens of thousands of adults from diverse backgrounds. That does include older adults and communities of color. So we have looked at some of that initial data. As Jeff mentioned, the clinical trial data do show that both these vaccines are safe and effective. And these are going to be arriving in our community soon. So it's something to celebrate and be excited about. It's also, it is a immense effort that we're excited to take on. So we're likely going to see maybe even more than 20 million vaccines from each Moderna and Pfizer. I know they're looking at additional vaccines there. And these vaccines are going to start being distributed this month and into April 2021. Also, just from some of the clinical data we've seen thus far, it is still unknown how long the protection of these vaccines might last, but that's certainly something that we'll continue to monitor. I'll just mention, just so this group knows, we have been drinking from a fire hose when it comes to the amount of the information that's coming in at us. So our teams are reviewing that diligently, and this presentation, our plans will continue to be revised and looked at as more information comes in from the FDA, from ACIP, and from the State Health Department. A couple other vaccines. So these are additional couple vaccines that might be available in the United States. The Johnson & Johnson vaccine, we might see them looking towards emergency use authorization in January and February. The AstraZeneca vaccine in February and March. So that does give us several vaccines, which is great. It also it also adds to the level of complexity of our effort. So some of you might have seen some of the data around this. Each one of these vaccines is different in the way that they are handled, the amount of doses that will be needed. Most are 2 doses, but even between those vaccines, there's a different time frame between the first and the second dose. So it does add complexity to our vaccination campaign, and we're ready for that. I just think we need to know that as a community and be patient and really work really hard to ensure understanding of the vaccines that are out there, which vaccine you're getting, knowing that you'll certainly have to have that exact same vaccine for the second dose. Those are all logistical issues we're working through as a team and are excited to take on. Generally, just to state this again, this is an immensely complex vaccination campaign. It's historical. I mentioned the need, the handling of certainly the ultra low needs for the Pfizer vaccine, frozen even with the Moderna vaccine. Certainly then handling the vaccine to get it ready to administer to community members is a challenge. So just wanted to reiterate the complexity of what we're working towards. We are very clear and we're working very hard with our communications team and a larger public information group in the county to look at the perception of vaccine safety and efficacy, and really informing and giving our community members the information they need to feel confident in accessing the vaccine. And one crucial point I want to mention here around the complexity is community engagement. I want to reiterate the need with this group for community engagement with our priority populations in the county. I know this group has heard this many times. We know the community members of color, Latinx community members have been disproportionately impacted by the COVID-19 outbreak. And they also traditionally have lower numbers of vaccination rates. And so we know that, and it's going to be our job to really engage with that community, do grassroots community engagement. Sheila Davis, our health equity coordinator, has already started doing tremendous work in this. We're excited about that. So that is just something that is going to frame our plan generally, is that health equity lens. I really like this slide just to talk a bit about and situational awareness around the challenge of the vaccine. So we really know right now that the supply is very constrained, and we're seeing very little vaccine for the state of Colorado and really Boulder County. So with that in mind, this really does need to be initially very tightly focused. And the strategy has been, we have worked incredibly closely with all the hospitals in the county, the 5 hospitals, the hospital systems in the county. They are ready to go, and I can't talk highly enough about the leadership with our hospitals in the county, and all the staff and all the incredible staff from pharmacy staff to infection prevention staff that have been engaged in these planning efforts, have already thought about their plans, are ready to go. So we're excited about that. And so those are those closed settings right now are really best poised to receive vaccine. And so that's how the plan is working right now. What is good and what we're planning on is we're going to start to see more vaccine on a weekly basis come into the county. So ultimately that supply is going to start to meet the demand. So we'll expand beyond those initial populations, and I'll talk a little bit more about who those populations are, and really leverage all the immunization infrastructure in the county. So doctors' offices, clinics, public health doing vaccine clinics and strike teams to get out in the community, leveraging retail pharmacies in the county. And then ultimately we'll get to a point where there's sufficient supply, and this potentially could move into an annual vaccine campaign. So we're at that very uptick, or very start of this endeavor. So it's exciting to be there. You might have seen, so the state plan did put out a phased distribution plan. You might have seen the initial Colorado state plan, which is what our internal plan is based on in Boulder County. There's been some shifts just recently to the phasing of that, so I just wanted to point that out, and we're revising our plan currently. The statewide plan, the phase plan right now, just to be clear with this group, is really focused with this limited supply on frontline healthcare workers that have prolonged exposure to COVID positive patients. And so those are going directly to our hospitals and our community. Additionally, we're very excited about that. The first, and this should happen in the next couple of weeks, both staff and residents in long-term care facilities are going to have access to this vaccine. And I think this group knows, and you've heard us talk about this. It has been so sad to see the disproportionate impact on community members living in assisted living or long-term care facilities. And so they are going to be some of the first to receive this vaccine. We'll then move into phase 1B this winter. So these are additional healthcare workers. These are workers, so these are outpatient healthcare workers as well, working in outpatient settings. And additionally, this will be first responders will be in this group. So EMS, firefighters, police, correctional workers, some public health personnel will be involved in this. And so those are the first initial phases we're going to see. Those are very, again, closed and targeted initially. And then we'll really move into the bulk of the vaccination campaign into the first quarter of next year. And I'll talk a little more about that and what that looks like. But these are certainly higher risk individuals and essential workers in the community. And this is going to be really an all hands on deck response once we get there. And then ultimately this summer, the general public will have access to the vaccine that don't fall in those other categories. Just a little context around how it's being distributed across the nation, the vaccine, you might have heard this. So the allocations are being based on population, and Colorado is it has a pretty small population density, so about 1.7% of the population. That number of 338,000 doses of the Pfizer vaccine, it's still unclear if that's what we're going to receive. But it gives you some context on the amount of vaccine we might see in December from Pfizer is pretty low. So again, it's a constrained environment with vaccine availability. And we will add to that we're only going to see half of that vaccine allocation to ensure we have enough supply for that second dose. So really our strategy, and we're excited about it, I mentioned this. So the hospitals, again, have been remarkable and they're ready to go. And so they are going to take on, working with hospital and healthcare workers, getting vaccine to them. I will mention that the residents and staff in long-term care facilities are really excited. There's a federal partnership that has been created and is fully underway with both the CVS and Walgreens pharmacies. We have ensured that all 40 plus facilities in our county have signed an agreement with CVS and Walgreens, and they're starting to dig into that right now. That partnership and that group should start to see vaccine in the next couple weeks. So that's very exciting. As we look at that 1B group I mentioned, that critical workforce like first responders, we're going to leverage public health to be able to provide those vaccines with drive-up vaccine clinics and just potential of working with other partners, certainly strike teams going out and doing vaccines for the community. And as we move into phase 2 and 3, those are certainly under development. You've heard me talk about some of the strategies there. Ultimately, for this group to know, we are going to leverage every partner we can access and bring on board to help with this. So these are clinics in the community, federally qualified health centers, primary care providers. We know that additional pharmacy providers, 12 large pharmacy providers, will then have access to vaccine. So it really is the messaging and letting folks know where they can go and access vaccine, filling gaps, ensuring culturally appropriate communications. So we're reaching the right folks in the community. You can learn more right now. I think we really think the state of Colorado has created a very comprehensive site that has a lot of information. You can really dig into the the vaccine development and look to see where the trials are at and other vaccines, dig into emergency use authorization and the recommendations from the advisory committee on these various vaccines. Additionally, there is a call center for the general public to answer questions, and that's our co-help number. So we would encourage folks to look at that. We are developing a site for Boulder County Public Health, and that'll be available here soon. This is a kind of an ending message for you all and for the community is, ultimately we really hope that you do access the vaccine. This is going to help us, Jeff mentioned, the schools and our businesses and our economy. So this is incredibly positive. We're excited about it. And we really hope that the community then is able to access this vaccine. So thank you very much.
Board members, let's see if you have any questions for Chris, or anybody else on the phone. Multiple people on here that can help answer.
Thanks, Chris. This is Greg. So is the vaccine going to be free to most people?
Yes, it is. It is absolutely free. So there is a chance that some providers will charge an administrative fee. They would charge that to insurance. I do know if someone is unable to pay that administrative fee or is uninsured, there are funds available. So you will not, community members will not be charged whatsoever for the vaccine.
Great, thank you.
Thanks, Chris, for this presentation. This is Morgan. I know Boulder County does not have, we struggle with vaccination rates among kids. I guess I assume that's true of the adult population too, although I don't know what those numbers look like. But, and you touched on this a little bit. I was under the impression actually that communities of color were actually a little bit better about vaccines than Anglo populations in Boulder County. I don't know if that's true or not. Can you talk just a little bit about that? Because obviously that's a concern that we struggle just to get our kids vaccinated at a high enough rate in Boulder County already with vaccines that have been around for decades.
Absolutely, yeah.
Do you want me to answer that, Chris?
Yeah, great. Thank you, Indira. Go ahead. And I know
Yeah.
Sheila is able to answer as well.
Chris is doing a good job. He's taken over all the vaccine planning. So kudos, Chris, for a good presentation. Morgan, you're right. There are segments of the population in which vaccinations the uptake is much higher. Traditionally, we see that a lot with new Americans. So individuals that may have immigrated to this country where vaccines weren't necessarily as widely available. But with the historical injustices that we've seen among communities of color, we know that people of color, particularly African Americans, are very hesitant about getting the vaccine. And there is some data that CDC and CDPHE actually did some survey research as well that shows that the uptake among African Americans is probably lower than even the Latinx population. And so what our plan is to make sure that we have culturally responsive messaging. And we are also in the process of potentially hiring a cultural broker to sit in on our COVID vaccination planning. And the goal there will be to help inform the planning with that cultural responsive lens.
I'd like to add to what Indira shared. I'm a vaccine equity champion for CDPHE, and I've been having conversations with different groups of color across the state, and vaccine hesitancy among African Americans, at least nationally, is on the order of like 35%. Like only 35% of the African community plans to get a vaccine, and it's slightly higher for the Latinx community. So one of the things that I found is that there's just such a mistrust of government and healthcare systems. And so part of my strategy has been sort of one of truth and reconciliation, where I'm very transparent about the data, and I'm inviting people to look at the data with me and sort of to walk people through the process.
What do you find when you do that, Sheila? I mean, have you been around folks who aren't kind of necessarily at the planning committee level? And what's their general reaction when you do that?
That it makes a difference. That, yeah, that, I'm not pushing any one vaccine on anybody. I'm just, here's the data. This is an opportunity for us to end this pandemic, for businesses to return, for kids to go back to school. Let's look at the data together, has been my approach. And it's working so far.
Good. Glad to hear.
This is
Landry, just a quick question. What communities do you outreach, and how do you get access to sort of more than just one-on-one interaction? Like, is there a strategy to reach out to these communities in a broader way?
So CDPHE has been assigning different groups to me. And it's basically communities of color. They've been my audience. So that's the strategies thus far.
This is Brooke. Do you all plan to use the same strategies? Because like Morgan mentioned, there's a large white anti-vaccine population in Boulder. Are you all planning to target the anti-vax groups?
So that's a good question, Brooke. I think that I want to just share that we did some focus groups a few years ago. And what we found was that the vaccine rates and the uptake in Boulder County look low because a lot of parents choose to not follow the schedule. But when we did the focus groups, what was fascinating is they shared with us that they actually consider themselves pro-vaccine. And the total percentage of people that are completely anti-vaccine is actually quite low. And so I think it's just going back to what Sheila said, creating that transparency, sharing what we know, what we don't know, and then just encouraging people to take the vaccine. But we don't cater to the anti-vax movement. What we do is really promote the vaccines, particularly among parents and individuals that are vaccine hesitant.
So Andrea, is that something, I mean, because again, I'm thinking about like kids aren't even eligible at this point to get this vaccine. So,
Yeah.
Do our adult vaccination numbers look better than our kid vaccination numbers?
Our flu uptake is similar to what we see across the state. I think it's closer to 60%. So I do think that most adults, do get vaccinated. I think it comes down to where we see the biggest challenges sometimes are just hesitancy among children and just following that schedule.
So just to clarify, so we are seeing high full vaccination rates. It's just the numbers are skewed by not following the schedule. So they're just becoming fully vaccinated later.
Yeah, it's really interesting when you look at children and you look at the data when they get, by the time I think they're 15, they're usually caught up on all their vaccines. So, and our vaccination rates actually look pretty good. So what we have done is taken once we did those focus groups, we've just kind of taken a different approach, a very inclusive approach that, we want you to follow the schedule, and we celebrate the fact that you consider yourself pro-vaccine. And so, and people they consider themselves very much advocates for immunizations. And so we celebrate that, but we do ask our providers to really work closely with families to encourage people to follow the schedule.
As a PCP at a community health center at Salud, that's what I see. But I will say it's very hard to keep track of when patients are way off the schedule. And so you'll have someone where you can get them a few parts of the vaccine, but it takes years and years to really catch all the missing vaccines. So it is a really challenging group.
This is Brooke again. I have another question. So Chris, on your ramp up, is that based on assuming that they'll be able to increase manufacturing of the mRNA vaccines? Because manufacturing is going to be, I mean, I've looked at mRNA for over a decade. It's hard to manufacture at scale. And so is the ramp up based on that or the anticipated approval of some of the adenovirus and DNA vaccines?
Yeah, and Derry, you can answer that one certainly. From my perspective, that's again what we continue to hear, and those are some of the planning assumptions we've been asked to make. So yeah, I think it's both. I think it's continued. It's looking forward to additional vaccine from the different types of vaccines. So it's kind of all of the above. So again, that shows how challenging it's going to be because we're having so many different types of vaccines in the community, and it's positive because we'll have a large amount of vaccine.
Got it.
I just want to add, I think Chana's going to put up on our website, our goal is to really kind of align our communication messaging with the state health department and our regional partners. Dr. Anuj Mehta, who's a pulmonologist, recently did a really great presentation for Denver Public Health on the mRNA vaccine and kind of explained how it works in building the body's immune system. And so we do hope to keep pushing out that type of information that's based on science and explaining to people about the vaccines. And we're hoping that, people pay attention. And if they have questions, also the state health department has set up a COVID call center. I think it's the CoHelp. Is that right, Chris? Yeah.
That's right. Yeah.
Any other questions from board members? Okay. Thanks very much, Kristen and Dira.
Thank you.
All right, Greg, are you ready for me?
We're ready for you, Jeff.
All right, I will go through quick update here. I will share my screen. So again, as I mentioned, as a precursor just a little bit ago, very good news right now. We were a little bit worried about seeing a spike during Thanksgiving. So much so that the Colorado School of Public Health held off from doing their typical weekly update until earlier or this week. They wanted to see the data from today because they were worried that either we had slow reporting or we were missing something, but the data continues to look good. So at this point, we are headed in the right direction and we want to continue to head in this direction. That's what's going to be so important about this. As you know, we're still in the red level, which is severe risk. We are at 593.3. This was as of this morning, so might have changed this afternoon. But when I was reporting on this, we were mid 600s last week to other folks that I was presenting to. So we're headed down in the right direction. Just a reminder, in order for us to change to orange from red, all of our indicators need to be in the orange level, and they need to be there for at least 2 weeks. So our incidence rate, which is the one that's out right now, would need to be below 350 for a 2-week period of time. And we would need to be stabilized or decreasing on the trend. So CDPHE would look at this from a perspective of, okay, you've been there for 2 weeks. We want to make sure you're on a stable rate. It can't be that we've come down into the 200 or less than 350 range for 2 weeks, but then we're starting to trend back up. They would probably hold us and watch that trend to make sure that it's not a trend that is going to carry us back into red. So again, looking good across all of our indicators, 6.6% on our 2-week average positivity rate, 10 days of declining or stable hospitalizations. I'll show you our actual numbers. Again, this demonstrates across the metro, that we're on a consistent decline at this point. Very positive for all of us. This is what we want to see, and we want to continue. This is the number of cases since 11/1, and the orange are long-term care facilities. What we're seeing primarily, and Indira, please add if you want to emphasize anything else, but majority of cases that we're seeing come in from staff. I think, as the board members know, all these facilities can't test on a daily basis to assure that they're picking up infections as soon as they're showing up in people. So we are in a very positive spot, though, as Chris mentioned, because we do have contracts in place with strike teams that will allow us to get vaccine to this. This is a high-risk population. It's in that first priority. And we have contracts in place to make sure that these facilities are the first on the vaccine list, because we know that they have a higher number of impacts in terms of death in this age group. And this is our current 5-day average number of cases right now. We're at 121.4. This is still more than we can effectively case contract and case investigate, but the number is headed in the right direction. Again, you're going to hear my message about really wanting to encourage people for a whole host of reasons to continue the good work that has happened, certainly around the Thanksgiving holiday. This is our case rates across, or our 2-week incidence rates, across all of our age groups. And you can see that all of these are declining. We had an increase in our 75-plus-year-olds right here, but we are starting to see a decline in those as well. And just as a reminder for everybody, typically what we see when we see increasing case rates is then following that a lag in hospitalizations, but we then see a increase in hospitalizations, typically 14 to 16 days behind the case rate increase. And then finally what follows, which we've clearly seen here in Boulder County, as well as across the state, is deaths that then increase associated with those hospitalizations and cases increasing. But this is a good trend. We want this trend to continue, and we want everybody who's listening to keep doing the right things. Maintaining social distancing, masking works for sure. Do not gather with people outside of your household. We don't have a lot longer, and we are going to see some changes based on vaccine. And if we can continue a decrease with these numbers, we're going to be in a much better space. This is the total number of tests that we've run. We have testing capacity in Boulder County that's really adequate. What we want to make sure we're doing is continuing to message to people that we want them to get tested. The data I saw from our EPI team last week indicated that 38% of symptomatic and asymptomatic cases across the state are being picked up, but that means that there's a lot of people that we're not picking up. And we want people to come and test. We have adequate testing capacity. Our testing has been extended through March in partnership with the state health department, as well as the use of some of the CARES funding. So we are able to continue that testing in our community at least through that period of time, and we want people to continue to test. This is our number of hospitalizations. We're down 71 here. We were up in I don't remember exactly what our highest number was, but it was 130s, 140, right in that range. But we've seen a decline over the last week. We're at 71 this was as of 12/11. And we hope to continue to see that decline go down. And what I wanted to share is that, or actually I'll share it in the modeling data because it's pretty consistent across the state. This was the data that we shared today with the teachers at St. Vrain Valley School District, and that we'll be sharing with Boulder Valley School District as well during this week, as well as with a parents group tomorrow night with St. Vrain Valley School District as well. But the Colorado Health Institute, via the Metro Denver Partnership for Health, I think everybody knows they're our administrative services organization. And we re-looked at the data that's out there. We included Children's Hospital when we did this, and it's pretty clear from the national data as well as the local Metro Denver data that they've collected, and in talking with experts like our local pediatrician who is part of the American Pediatric Association, that the data that we're seeing both nationally as well as locally is continuing to emphasize that, especially for K through 5, that 10 years and younger age group, there's low risk of super spreader events occurring. We're not seeing super spreader events. We know that our children need to be in school because we've lost years in some cases, based on the research I've seen, that our children have moved backwards by not being in person in school. In addition to that, we know that we have parents who have had to leave the workforce. That's not only happened in the nation, but it's happened right here in our own public health organization, where people have had to step back from the work because they have to take care of their kids who can't be in school. So this population is especially important to continue to focus on. Make sure we have full in-person with K through 5. That are the recommendations that we've made to both St. Vrain Valley School District and Boulder Valley School District going into the fall. That's also what's represented on the state dial and in the policy framework, as I'm sure most of you know. This is just a few more points, and this is from the in-person learning in the time of COVID, a white paper that CDPHE has published in November 2020, just illustrating the same things. K through 5, lowest risk, a little bit higher risk with grades 6 through 8 and grades 9 through 12. But in general, transmission appears to be happening from interactions that occur actually outside of the school, which is a pretty controlled environment with masking requirements, distancing, a much more controlled environment in terms of how kids are interacting across the day. So we know that, again, those school environments are places of lower risk. This is the modeling that I was mentioning. And again, the Colorado School of Public Health will update this modeling this week. This was from last week, and at last week's, when they did this, they were looking at a 71% transmission control effectiveness right now in the state of Colorado. So what these lines represent is, with 71% transmission control, if that stays consistent, then if we move forward, then this line is what is projected to occur in terms of our total active hospitalized patients. This dotted line up here is the hospitalization surge capacity for the state. So we're well below that in all 4 of these scenarios. Obviously, what we want to do is hold to the lowest scenario, because we know we're going to stress our system less. We're going to have more chance to have our businesses back open. We're going to have more chances to have our kids back in school, less social and emotional issues that we know we've seen increases in across the board with our data. This is the active ICU patients, and here is the dotted line for ICU patients. So in these scenarios, if we relax too much, we do peak in the 30% lapse with ICU towards the middle of January. So we want to stay away from this scenario. We again want to stay at 71% plus. The higher we go, the better the chances are that we get out of this as quickly as possible. And you can see the trajectories in terms of when the hospitalizations come down. And remember that we would expect to see cases come down before that. So we're really shooting for making sure we're doing everything we can. And that's really what the key messages here relate to, is that we still, this was as of last week, but still a high level of infectivity in our community. This number will likely change based on the latest numbers that we're seeing, but it won't change drastically, I don't think. We're still going to have a lot of infection in our community, and we're really going to need to not let up and make sure that we're continuing to focus on gathering only with people in our own homes, masking, social distancing, washing our hands, all the things that we've been talking about for so long. Only about 16.5% of the people in Colorado have been currently infected based on CDPHE's and the Colorado School of Public Health's latest estimates. So we still have lots of folks out there who are positive across the entire state. And these numbers will vary depending on the region that you're looking at. But in general, across the state average, it's 16.5%. So we can't let our guard down. We've got to make sure that we continue to focus on really following these things and getting that message out again and again and again. And it's definitely for the benefit of our businesses, for the people who have died in this horrible disease, and for the behavioral health and mental health aspects that are so significant that are associated with all this that we're aware of. We've seen suicide increases in addition to the deaths that we see with COVID. So we know this is going to have long-lasting impacts on people for years and years to come. So we need to keep focusing. We've got some light at the end of the tunnel with the vaccine, and we can get through this, but we have to keep focusing. So I'll stop there and see if there's any questions.
Thanks, Jeff. So I'm curious, have you guys done, when you look at the time series of whether, let's just say, new cases since March, have you guys like created a graph that has like milestones, whether it was July 4th or when various public health orders were implemented, so you can kind of see like rises and falls based on either holidays or administrative actions?
So we're actually putting that together. Go ahead, Indira. Do you want to jump in? Go ahead.
We have, Greg, but they're mostly been internal. But it's been looking at, particularly after the public health order went in, I believe September 24th. I did work with the data team to look at what happened with community spread during the incubation periods, because we often see community spread after a big surge. You'll see your increase in hospitalizations usually 2 weeks after, and then we also saw deaths. So we have done that, but it's mostly been internal. But we know it's pretty standard textbook. After a surge, you do see those increases in hospitalizations and deaths.
And Greg, this question was also brought up. I don't know if you had heard the governor's press conference last Friday, but this question was brought up on that press conference. And they are looking at, they have looked at, the state has actually graphed it. You can find it on the state's website at a statewide level, what happened after different series of things went in place. Like when the state moved counties from orange to red, what kind of effect did that have? And Rachel Herlihy was questioned directly from a reporter, and I agree with certainly what I heard her say based on the things that I've seen, which is you can't really point to one specific thing. The one specific thing that we can pretty much point to is that we know that with each of those gatherings around holidays, we definitely see surges, and that's been consistent in our data. But we don't know if any one strategy had more impact than another. It's really the combination of strategies that everybody agrees is having an impact. But it's hard to point and isolate just one of those things as being more significantly impactful than another. It's really important to keep messaging that all these things together are really important.
Yeah, good. Well, good news at least so far on the Thanksgiving front. Maybe we finally, enough of us got the message, and hopefully that's why we're not seeing a spike 2 weeks now later.
Jeff, this is Morgan. I know you touched on this in the presentation by saying that we're seeing increased suicides. I mean, I was talking to a friend of mine who is a nurse, an ICU nurse, and she said that they're seeing just a lot of people in the ICU who have OD'd as opposed to more COVID patients in the last week here. So I don't know if it sounds like you're tracking that data, and obviously we're trying to be mindful of it throughout this whole, and I don't know if there's any strategies public health is taking to try to address that.
Indira, go ahead. I see you came off.
Yeah, Morgan, we actually were just looking at that data today. The overdose, I think, is almost 3 times the rate this year than we've seen in the past. We monitor with syndromic surveillance, which is chief complaint data from the emergency departments. We've seen that there have been increases, particularly with opioids, but the overdoses, hospitalizations have gone up significantly. So we are monitoring it. The substance use advisory group does meet, and they're going to be having a conversation on that in January to address it, because it really takes a community-wide perspective, and just making sure that there's access to mental health and substance use treatment. I know that there's a lot happening in the community with mental health partners and some of our community partners. Everybody's working really hard, but it's such a stressful time. And for people with addiction issues, it's just exacerbated, and it's just really hard. So, yeah.
Yeah, Mental Health Partners has been on many of the town halls or presentations that I've done. So they're integrating to make sure that they get the word out there. And so, but it is what Indira said is absolutely true. We met with Flatirons Church this morning for an hour, and that's where we heard about some of the mental health and behavioral health challenges that they're seeing from a church perspective and how important that is at this point. And we know there's serious struggles, and there is going to continue to be serious struggles until we move outside of this. This is hard for everybody, and as we all know, it's going to leave lasting impacts on all of us. So it's been a pretty tough time. And I think that the things that we can do at this point are being done, which is making services available to the maximum extent possible, sharing information, and trying to help support each other.
Any other questions? Hey, I guess just to close the loop on all of this conversation, so maybe Chris or Indira, you can answer this, but kind of goes back to the vaccines. So, you know, if let's say by the end of the winter, 20%-ish of Coloradans have been previously infected with COVID, and then let's say over the spring, you know, we get a significant uptake, let's say 50% of folks take, who haven't been previously infected, take the vaccine, so that we're at close to 70% either vaccinated or recovered. Is that enough? Because, you know, I mean, we hear herd immunity stuff a lot, and I think there's hope that 70% is good and should certainly reduce the transmission. But for things like measles, you know, we get nervous when things drop below 90. So curious your perspectives on that.
Indira, do you want to take that one?
Sure.
Or Chris,
So,
either one of you.
I think one of the complicating factors with COVID is the immunity component. So right now we stick to the fact that if you have had COVID, you're immune for about 90 days. But we have seen reinfections, and I'm sure you all saw in the media where people have reported reinfections. So I think it's going to be important, even if people had COVID, that they make sure to get vaccinated so that they can, you know, make sure that they're adding to the larger, you know, their immune system. And COVID vaccination is probably here to stay, right? It's probably going to be very similar to your seasonal influenza shot that you get. You'll get a COVID shot as well. I would say that with respiratory aerosolized diseases like COVID, like measles, you tend to have a higher rate of percentage of the population that need to be vaccinated. And while 70% might be okay, it still might be endemic to a community or to our state or to our nation. So we may strive to have even higher rates. I think that will probably be the goal. And particularly for older adults, people who have chronic conditions, those who are immunocompromised, we need to protect them. And so making sure that we create safe bubbles around them, making sure that people are vaccinated, it's going to be really important. Making sure they're vaccinated is going to be key. So the science is still out, Greg. It's a great question. Yeah.
Thank you.
But I do hear sometimes politicians say, oh, not everybody has to get vaccinated. Well, I'm not sure that we know that yet. So at least with measles, you know, measles is so highly infectious. It can, you know, the reproductive number is so high. It can, I think it spreads to 18 people, and you can expose 18 people in one measles exposure. So COVID is not as high as measles, but it's still up there as a respiratory threat.
Thank you for that. Okay, well, thanks, team, for that comprehensive update on the COVID. And we will go back to the agenda. And that is item 4, recognition of Heather Crate's work to champion health equity in Boulder County. Jeff, I was proposing to read this into the record. Certainly happy to defer to one of you.
Well, I think it would be great if you would read it, but I'd love to, number one, just defer to Sheila and Nadine, who may want to make some comments relative to this, but and then I'll just make a quick opening comment and then maybe add a couple at the end, but just very excited to be doing this. Heather is here with us tonight, and Heather has just been such an incredible asset to Boulder County Public Health, and I'm so appreciative of all the work that Heather has brought forward, and the growth that I've seen in Heather has been just incredible. I'll talk a little bit more about that at the end, but would love to open it up to Sheila and Nadine to make some comments maybe before you read the letter into the record.
Okay.
This is Nadine. I won't speak a lot, but I just want to say that I think I've been doing this work, anti-oppressive work, for a long time, and I don't meet many people like Heather, who they are the epitome of what it means to be anti-racist and anti-oppressive, and they lead by example in their family and out in the community, and it's been an honor and a pleasure to go on a journey with them, and I am very proud that they are being honored today. So that's all I have to say.
So I've had to fill Heather's shoes since I have assumed the role of health equity coordinator, and Heather has set the bar impossibly high. I hold space for conversations about race and gender expression, and these conversations have intensified since COVID, the pandemic started, and with the murder of George Floyd. And sometimes, frankly, I go home with a migraine. These are conversations that last for months and years, and this is the work. This is the work of centering racial equity. So grateful for all that you do, Heather.
Thank you.
Okay, so thank you for those introductory words. I will go ahead and read the letter, and then we can get back to the board and to Jeff and to others, okay? All right, let's see. Can you hear me okay?
Yes.
Okay, good. Dear Heather, great leaders like Stacey Abrams understand that all voices must be heard in order to achieve equity. One could say that you are following in the footsteps of Stacey Abrams in Boulder County. Your trailblazing work as Boulder County Public Health open and affirming sexual orientation and gender identity support program, or the OASIS program, most top people refer to it, is saving lives. You have worked tirelessly to ensure that LGBTQ youth are seen and heard in Boulder County, create socio-economic, emotional spaces for LGBTQ youth and young adults in Boulder County to thrive, and 3, partner with LGBTQ youth to inform and push protective policies in schools, both locally and at the state level. With a commitment to dismantling structural racism within BCPH, you led and organized the Health Equity Transition Team, which provided a framework for the launch of BCPH's Health Equity Coordinating Committee, or the HEC. Serving as the HEC's inaugural coordinator, you leveraged your excellent group facilitation skills to develop cohesion within the team and cultivate an environment that allowed committee members to come to a deeper place of understanding around equity principles. HEC then developed a strategic plan for centering racial equity in the work of our agency. This has been challenging work, requiring much of your time and effort, much more of your time and effort than initially thought. You facilitated difficult conversations while keeping the group moving forward under complex circumstances. You stepped up when needed while balancing multiple competing interests. Your work in this area created the foundation for the joint Board of Health and County Commissioners resolution declaring structural racism as a public health crisis in Boulder County. During your tenure as HEC coordinator, you became an equity thought leader and have been sought after often for your coaching and mentoring skills. You provided training for BCPH divisions and other local public health entities on basic principles of health equity and the importance of gender expression and implicit bias. In addition, you have been on the front lines of BCPH's COVID-19 response, serving as the liaison to the county's K-12 educational community. Your passion for advancing the welfare of children is evident in your service to children in foster care. Your significant and sustained work in this area has been extraordinarily invaluable. You facilitated and coordinated extremely difficult and challenging situations, always representing Boulder County Public Health in an exemplary way. Executive Director Jeff Zayak said, "I have fully trusted and counted on Heather to represent, assess, and advance complex issues with our private school directors, as well as both superintendents of our local school districts, and Heather has done an exceptional job. I have received many comments directly from private school executive directors, Boulder Valley School District Superintendent Rob Anderson, and St. Vrain Valley School District Superintendent Don Haddad, expressing their appreciation of Heather's work. I have personally witnessed Heather's significant professional growth during this pandemic, and I very much appreciate all that Heather does on behalf of our agency. Change agents universally possess tenacity, commitment, integrity, and a hunger to make a difference in the lives of those to whom they are committed. Again, you possess these qualities and are a tremendous asset to Boulder County Public Health and the greater Boulder community. On behalf of the Boulder County Board of Health and all of us at Boulder County Public Health, thank you for your invaluable service to our community. Your contributions are deeply appreciated."
Well, I'd love to just add a couple more things. And oops, I see that my video.
Jeff, while you're adjusting, I want to jump in and just say that I want to echo all of these accolades about Heather and your work. And thank you. I have admired both your work and you as a person for a number of years. So I just want to say congratulations and thank you for all that you've done.
Thank you so much.
Let's see if other board members have any comments, and I'll wait till the end. Well, Heather, one thing that I wanted to say to you is I remember saying to you at one point, this will probably only take about 4 or 5 hours a week. And I remember that pretty soon into that process, it was clear that it was going to take a lot more than that. But you never faltered, not for 1 second. And it was in the face of what we all know was challenging and complex decisions. So you moved us forward and got us to a place where we are today. And I can never thank you enough for all that you've done. And one thing I wanted to share with everybody on this call, because this is no easy task, is Heather has stepped in to work directly with the superintendents on significant and challenging policy issues and helped move those things forward on their own, completely, without me on the phone and with incredible sustained results. And that's the kind of thing I keep hearing back from our superintendent. So I just want to thank you again. You've been an incredible asset. And I know I probably don't tell you that enough, but I so much appreciate your partnership and you being there beside me, because I know that I can trust what you do at any level. And I really appreciate that very much. That doesn't come easily. So, and I know you've worked really hard in really tough situations. get there. So thank you.
Yeah, thank you, Jeff, and thank you to the board and Nadine and Sheila. This definitely means a lot. You know, it's a lot of times equity work and anti-racist work and sort of diplomacy work that I've been doing with our K-12 schools. It's hard and it doesn't always, you don't always get results right away, and it can be slow progress. But knowing where we've been as an agency and where we're headed is really exciting for me to sort of hand over the torch to Sheila and the HEC. I'm actually transitioning off of the HEC tomorrow, which feels very strange to be kind of stepping out of that work. But yeah, and thank you, Jeff, for your trust in me and the opportunities to take leadership with our K-12 partners.
This also is accompanied by a nice bonus, which you will receive in your next paycheck.
Oh, nice. That is also nice. Yeah, thank you so much to everyone. I know I've had many equity conversations with almost everyone on here right now, so thank you all.
Woohoo!
All right, great job, Heather. Okay, let's see. We are going to move on to the next agenda item. And that is the 2021 approved budget.
And Marielle is going to take us in the lead on this. I appreciate so much Marielle's incredible work to get us to where we are today. And you'll see as Marielle goes through the budget that we've broken this out so you can see the difference between our some of the investments and resources that we have in the organization and what specifically we're investing in COVID and how that looks going into 2021. So Marielle, take us away.
Hi everyone, so I'm gonna start sharing the presentation and hope that you guys are seeing it.
We can see it.
Good. All right. So this would be our 2021 approved budget. And we follow by the agenda. So Mary Barron, Contract Purchasing and Budget Manager. Then we'll have a county update. Like Jeff said before, Ramona from the county is here to give us an update. She will also be doing a little quick presentation of what the county is doing. Then we'll follow by the budget schedule, some funding priorities that Jeff will talk about, the further impacts and consideration because of COVID and other areas. And then I'll go a little bit into detail about the budget. And then we'll have a few slides about revenue and expenses, what it's costing us to upfront COVID, and then we have some FTE comparisons, and then the fund balance, and then we'll have time for any questions if anybody has any. I'm going to give over control to Ramona so she can present with the county, and she'll be sharing a little PowerPoint presentation with you guys.
Thanks, Marielle. Let's see, like everybody else, let me make sure I can share. This is Ramona Farino. I'm CFO for Boulder County, and I appreciate you having me here today. I enjoy it every year, just being part of your board meeting during this time. What I was going to present to you, like Marielle said, very high level information from the county about our economics right now at the county level, and then a little bit about our budget, which we went ahead and approved and adopted last week. Can you see my screen at this point?
Yes.
Yes, okay. So this is, okay, so this is a picture.
Hold on one second, Ramona. If we can have anybody that is not speaking mute, it'll help that echo. It'll help get rid of that echo. Thanks.
Great, thanks, Jeff. So this is a picture, a graph of our sales and use taxes. And I just wanted to start here. And, as most of you know, our sales taxes aren't the bread and butter of the county, but it is what we look at when we want to look at the economic picture of the county. And, so they're all dedicated. These are all dedicated sales taxes. So they're for open space, vendor management, transportation, nonprofits, and sustainability. But I like to show this because if our sales taxes drop, then the general fund really has to back up all those programs. So it's important to look at this picture. So the blue line is 2020, green line 2019, red line 2018. I'm going to scroll down just a little bit so you can see the bottom. There's some numbers, probably too small for you to see. So I'll push back up here. So this year we are 1.12% in sales and use taxes over last year. So basically just call that flat. And the reason we're flat is thankfully January and February were amazing months before COVID, before the pandemic really hit. So we were up 6.69% in January, 12.89% in February, and then the bottom fell out, of course, in March when we had the stay-at-home order, and we were instantly down at 2.42% over the prior year. So because we had those great months, though, you can see that we're still flat. You can see right when we came out of shelter at home, April, May, June, we kept climbing and we got above 2019, and a lot of this, to be honest with you, is because of internet sales. In 2019, we had the Wayfair Act made internet sales taxable to counties and cities and municipalities. So really, if we didn't have that, we would be below last year, but we're just going to take that, that's to the good. So we are up now. I just got this data today. There's a 2-month lag time because the state collects our taxes. And I was, to be honest with you, disappointed. You can see October, that's our latest numbers. I was feeling pretty good there in September, we're rising up, and October we dipped down below 2019 October. So we've been just preaching just conservative at the county, because we just don't know, as you guys have been really interesting for me to listen to all the vaccine information. And as you say about being cautious, we still need to protect ourselves with the masks and everything else. Same thing with the economy. We still have to be cautious with our budget because, we don't know if things could get pushed out a little further than we expect on the vaccine, or like you said, if people don't get the vaccine as readily as we'd like them to. So that's just a picture of sales and use. But I wanted to show you is use tax, just to get a picture of the economy. Use tax for the county is mainly building permits. And what I wanted to show you on that is we were very concerned at the beginning of the year. This is pre-COVID. This blue line is 2020 for use tax. So we were seeing a slowdown in the economy. That's what that indicates. It's growth. There wasn't a lot of building going on in January and February, and that's brought our numbers down. Then, of course, there was really nothing going on here March. So we're watching that line very closely. It's an immaterial number to the county. It doesn't add a whole lot to that sales and use tax number, but it's a big indicator for us. And we've been watching that really steadily over the last year or so because, there's been that prediction in the next 3 to 5 years that outside of anything that's going on right now with COVID, that we were looking at a slowdown in the economy somewhat similar to 2008's recession. So all this is just to show you that we're being very cautious with our budget. So for 2021 last week, for the end of 2020, we're just predicting flat. For 2021, we're putting into the budget a 2% increase over these numbers. So very, very small, if nothing at all. But so we have not budgeted much for next year over this year at all. I'm going to digress from what I was going to talk about and just go really quick to this marijuana sales tax tab, only because I've been listening to you talk about overdoses and people in the emergency rooms. And as we know, this is only marijuana, but I think it paints a picture to what you were talking about. I don't have the numbers below on this one, the actual figures, but you can see that blue line for 2020 has skyrocketed. This is our sales taxes. This isn't, this is actually our sales tax dollars coming in. It's part of the bigger numbers I showed you, but we pulled out that MCC code just to see what it was looking like. And as much as, the county likes revenue, we don't really like seeing that because we feel like that's just not recreational anymore. We feel like that's most likely some self-medication going on there. And that's just, That's just what the picture seems to tell us. So I just wanted to show you that you're absolutely correct, that usage is definitely growing during this time, and hopefully will come back down later. So that is what I had for sales tax. We could talk forever on sales tax, but I wanted to just give you the big picture of the local economy. From there, what I wanted to show you is this screen here. So the county, as most of you know, is really our bread and butter isn't the sales tax, it's our property taxes. And you may have heard us, I'm sure Jeff, you did at our EODH meetings, talk about our huge concern earlier this year that with commercial property assessments predicted to heavily decline, and this was a prediction made by the state property taxation division, we were expecting a $25 million decrease in our property tax revenues in 2022 after the reassessment year. So this red line is what we were working on when we came up with our recommended budget. Here we are up here in 2020, we're growing in 2021, and then with commercial properties declining. It's hard to believe in Boulder County, but the prediction is that commercial properties, because of the closures and a lot of the places for lease right now, are going to decline. We were expecting, because of the Gallagher measure that we were going to drop about $25 million. You can see that in 2022.
Ramona,
And without
I
going
don't think we're seeing the
You're not seeing that?
screen. We're still seeing the marijuana sales. Sorry.
You are. Well, I'm glad you told me. So let me shut that one down. Okay, let's try this again. Thank you for letting me know that. Are you seeing it now? No?
Nothing yet.
This is where the rubber meets the road. Okay, let's try this again. All right, so I'm going to try to share, and I think I'm gonna have success. How's that?
That looks good.
That looks good. Okay, so let's start again with very quickly. The red line is what we were using when we were coming up with budget projections early in the year. Up here is where we think it would be in 2021. With the Gallagher measure, if commercial properties go down, their assessed values as predicted in the reassessment year, we would drop $25 million in revenue. And that is because the Gallagher measure says that residential properties can only comprise a certain percentage of the total property taxes. So that would mean that the residential assessment rate would drop, and we could have a whole seminar on that. But I'll just give you the good news is that the Gallagher measure statewide passed in November, as you may know, which means that the current residential rate will stay the same. So the mill levy will stay the same for residential properties. It's not an increase in property tax to a resident, it's just it won't drop. So we're allowed to continue collecting the same mill levy from residential properties. So with that, we had this nice blue line is what we used to create the budget we adopted last year. So we're still confined by 5.5% increases per year. That's still part of the Gallagher measure. So even if assessments, skyrocket, we can only take 5.5 of that increase every year, which is a benefit to our taxpayers. So with that, our recommended budget last week, when we adopted the budget, we did go ahead and change. We originally said we were going to adopt a base budget from 2020 with a 1% decrease in operating across the board in all departments, and no new projects at all. We were going to have to try to be very, very conservative. We remained conservative, but we removed that 1% decrease and left base budgets alone. So no decrease. And then the commissioners, because they didn't have the same scare, but because they wanted to be cautious, decided to add a few things to the budget. We used $12 million in one-time revenues that we were able to isolate for the commissioners, and we added to our budget some more money for our staff. Originally, we only had very limited increases for staff. They're still very limited, but we have a 1.6% range movement for all employees, January 1, that was adopted. Then we have a 1% merit that can be given out at the discretion of department heads and elected officials. And then also in January, there's a $1,000 bonus per full-time FTE prorated for lower amounts. And that is because the health and dental charges went up significantly this year. That is because we are self-insured And sadly, we've had some very difficult cases. Sad for the employees or their families that have had significant health issues, and being self-insured, that hits the plan. So rates have gone up, but the board decided to give a one-time bonus to everyone to kind of make up for that increase going forward. They also went ahead and just added money into some infrastructure projects, things that have to happen, like boilers and roofs, that sort of thing. Just, keeping the wheels on the bus, so to speak, as well as putting some money into that health and dental plan and also into our risk fund. So, they're not exciting things that we added money to with that $12 million other than our staff, but there were things that we felt like we had a little bit now. We don't know what the future looks like. So we decided to add a little bit in. And I just give you that big picture so that as you know, our budgets are not mutually exclusive from each other. So I wanted to let you know our philosophy right now and our conservative nature at the moment, but also the good news that we don't have to go ahead now and start thinking about cuts this year, next year, and then maybe really large cuts in 2022, thanks to the voters. The commissioners have been very thankful, have expressed their thanks to the voting populace quite often on this subject, because it really will help us just keep doing the things that we have to do. And of course, also support you all at Public Health for all the good things that you do. So that's all I have, because I don't want to take too much of Marielle's time, but if you have any questions, I'd be happy to answer them.
Makes sense to me. Thank you, Ramona.
Oh, you're welcome.
Absolutely. Thank you so much, Ramona, for that. All right, so there's no questions, so I'll move us over to the public health presentation. And I hope I share the right screen. You should guys seen the budget schedule. Okay.
Yeah, we're good.
All right. Thank you for that. So this is a little example of what the public health budget schedule looks like. So July through August, we kind of, work on the requested budget planning. What are we looking for in the next year? And then we also have the county request. So a lot of personnel numbers, a lot of other details that go into that. Then in September, we have the Board of Health study session that we did also this year. A little bit crazy because of COVID. Then in October and November, we finalized the approved budget. And then in December, we bring it back to you, which is today, to adopt our public health budget. And then I want to touch in the unfunded budget request that happened early 2021. And that is part of our draft budget amendment for 2021. So the unfunded budget request will be happening, or an email will be sent shortly, and the deadline would be sometime in January. And then in February, the director's team will review and consider any unfunded budget request. And if approved, they would come back in March for the BOH to adopt those unfunded budget requests or any other items that we need to correct in March. I think that's what I wanted to highlight, those UBRs, in that they are very contingent on what our year end look like. So we would have to wait for the county to close its books to be able to know how much money we have available for those unfunded budget requests. So I'll move us over. So Jeff is taking this slide and the funding priorities for 2021. So I'll give him the floor on this slide.
Slide on my screen. Did others lose it, or is it just me?
It's gone.
Yeah, we lost it.
There you go. All right. So what I wanted to do is just briefly talk about some of the priorities as we move into 2021. Clearly, one of our major funding priorities is you're going to see Marielle's going to outline for you the expenses for COVID and where we've invested. One of the things I want to say right off the bat here is that I want to thank Ramona and the county, because would we not be able to recoup some of the expenses that we had on COVID? There's no way that we would be able to fund what you're seeing, and it would have put us in a very difficult position, especially for the vaccine distribution around COVID. So Ramona, thank you. Thanks to Michelle, Jana, for working with us to really do the most we could to make sure we recoup those expenses, because that will allow us to be able to get some breathing room in public health, which, as I know you all know as board members, we desperately need right now. So we're gonna go through that a little more with Marielle. Wanted to highlight quickly some of these other areas. The health equity investments that we are continuing with 2021 is a priority. We're actually in the process of finalizing our new HEC members list right now, but we've been doing some priority vaccination planning. As you heard from Sheila, we cannot let up on this priority. We're also funding resource coordinator positions and with Nick Robles and others, and we're working really closely with the county on a plan to make sure that that work is actually integrated across multiple county functions that are going to be important to assure that that resource coordination is working effectively and efficiently, especially as we move into these next several months. We're doing priority testing in populations, which include our Latinx population. And we'll continue to bring the board up to speed on what that plan looks like as we move forward a little bit more with the county here. In the mental health area, and I want to thank Marcy Campbell, she's leading both our internal and our external mental health work at this point, but we are supporting internal mental health for our own staff. So think about trauma support, things like that. We're wanting to make sure that we're doing what we can to support our staff. This has been really challenging, as I know you're all well aware of. But it has been extremely challenging for our staff, and we need to put the time and effort into the internal mental health supports as well as our external mental health. We've been funding a consultant to work with our mental health work group on workload and how we adjust and prioritize workload, especially as we're in this really difficult time with COVID. And that mental health work group has been using that consultant to make recommendations to management team. And last but certainly not least, we're moving forward into 2021 with a continued development. Sorry, that phone's going to ring for a second, but continued development into 2021 on behavioral health hub development. And that's, as you might remember, implementing some of those recommendations of the Omni report. And that is a multi-county department effort as well as with folks externally. Climate change is still a very big priority for us. We are working on a plan with the county that we're actually going to bring to you next month in January that is looking at integrating some of the work between what public health is doing and Boulder County is doing. And we're looking at transitioning some staff in that process to help support the overall plan that we want to move forward. But again, we'll save some more of that for January when we come back to you next month. And as you remember, this was a priority that we added late in 2020, and that was based on the national reports that we saw relative to climate change and the urgency associated with it. Universal home visitations, and I'm covering several things here when I say universal home visitations. It's gaps to fill our universal home visitation pilot, which has been really successful with Clinica. We want to expand that pilot to Salud, and we want to engage in conversations with them on a deeper level. We want to look for some bridge funding to help support some of that, and there is a lot of focus on the statewide Colorado Thriving Families Partnership that you've heard me provide updates on. We were chosen as a tier 1 level support site in Colorado, and there is several steps that will occur towards the latter end of 2021 that are going to be important to both feed and support the universal home visitation approach that we have in Boulder County, as well as expand the primary prevention work that we're doing in the state. And I don't have other public health priorities listed. There's a lot of other work that's obviously happening in Boulder County Public Health. Some of those things are including TEP and the enforcement that we're thinking about in terms of moving forward and how to better support smoke-free areas and vaping. And there's a whole host of other work that happens day to day in our programs. But we also have to be ready for and have the ability to adjust if we have something major come up. And the one area that I want to use here as an example is a few years back, oil and gas became a major tipping point for communities across the United States. So we don't obviously know what's going to come forth in addition to what I've already talked about in 2021, but we always know that we need to be ready to adjust and shift if necessary to other emerging priorities that we need to be aware of, just like we did with COVID-19. So I'll turn it back over to Marielle.
Thank you, Jeff. All right, then we'll move. This slide is a little busy, so I'll go through it and just give you the highlights. So the reason for these slides is really to show you the impacts of our future budgets and considerations we need to take as we go forward. One of the considerations or impact is that our ELC grant will not be fully receiving the entire revenue until 22. And this is mostly because of a monthly payout schedule that we're in. So public health will be spending the ELC grant entirely in 2021, but we will not recoup our revenues until 2022. So I know Jeff is requesting and talking about the state of changing that payout, and that would actually help us immensely in getting those revenues in and not having to use some of our reserves in 2021. The other impact would be that we are subject in this 2021 budget on a $2 million kind of like saving from or help from County CARES Act. So as Jeff mentioned, the county was very kind and graciously giving us money and has allowed us to have that extra $2 million to cover some of the COVID expenses that you'll see later. And there is also an additional $2 million in excess that we did not spend on our 2020 budget, and that was mostly because of COVID. So those a little bit $4 million are actually what's keeping us at a very good level for 2021. Now I wanted to give a little bit more detail of the UBR process that will take in January through March. And we'll need to wait for 2020 to be closed to make appropriate assessments of what we're able to give for those unfunded budget requests. And we are considering only a one-time project or cost. We will not be approving FTEs for unbudget funded requests for obviously multiple reasons. So those are the highlights for the UBRs. And as Ramona mentioned earlier, there is that 1.6 COLA that the BOCC approved, and we are very graciously happy that they're considering that, even though we're going through COVID. Public Health is requesting a 2% salary increase, which includes the 1% from the BOCC. Also, this is a reminder that in 2021, Public Health will not be able to continue using or saving on those fund vacancies. So whenever we have a vacancy and we have a saving, the county will take back those savings, and it can equate from $300,000 to $500,000, give or take, depending how our vacancy savings are that year. We continue to get flat funding or losing some grants, and that's obviously affected some of our revenue, and you'll be able to see a little bit that in a further slide. The other thing that the Public Health Budget Office is recommending is a strategic budget review to be conducted for the 2020 budget. And to give an example as to why we're recommending it is that every time we increase 1%, we increase more or less about $150,000. Or if this year, for example, we have a 3.6 to a 5% increase, it costs public health between $540 to $750, but the county will only cover $250 through $350. So the remainder on the money really comes from the public health reserve. And with flat funding, grant losses, and because of COVID, we really need to take a look at, what is the future and we really assess our programs and our fundings going forward. So that is one of our items recommended for their 2022 budget. And I'll go ahead and move. So in this slide, it's a little bit easier to read. It's a revenue and expense comparison. So you can here see all the programs that public health has. For example, in the admin team, we're bringing in revenues of 14% and we have expenses of 15%. But then you have our holding account and our reserve funding, which that is composed of the little bit of $4 million that I talked about earlier. And then you have COVID, where we're only bringing about 6% in revenues, but then we're spending about 28%. So that's a big gap. And then you see our other programs that their gaps are not that astronomical. But this is a good example of what the 2021 budget is bringing forward. And this is just a little busy, but it really gives you a good picture of what our budget, or revenues and expenses are really allocated for. So our 2021 budget is $23,640,000, and that is very heavily because of COVID. And there is about $6 million just dedicated for COVID in this budget. We did have some decreases. For example, we had decreases in the county, and that was mostly due because PACE and KICP moved back in March. And that trickled down to our county tax where it decreased as well. You can also see a few decreases in grants and then a big jump on increases from COVID and a few grants that we received. There is a small increase on our fees, and that is our water quality fees were increased in, I think, the September board meeting. We have other decreases in private due to our Gary Piton grant close. And our holdings obviously is all we have in excess from 2020 after taking into account all our COVID items. And the reserve balance, those 5.5 million, is what we're plugging into the budget from the public health reserve to keep us afloat in 2021. So we've had those savings from the county helping us out in that additional $2 million savings from operating. That 5.5 is what we're plugging into the budget to really keep us afloat, and thanks to those almost a little bit over $4 million. So this is just really a good picture of, kind of telling you where we were on prior years versus where we are now, and really giving you a description of, what are the things that have accounted for those increases or decreases. Our next slide talks about where really our funding comes from. And in here, you can see that 32% comes from our county, and then we have a 21% from the state. So if it was a non-COVID year, you would see these two are bigger pots, but then we really wanted to break that and give you a picture of how much of our budget or our funding is coming from sustaining COVID. And that figure, I know I mentioned, it's about 6.4 million that is really just assigned to COVID in here. And then the other ones really stayed about the same percentage from 2020 to 2021. This is our spends, and once again, 58% of our expenditures in 2021 are geared towards COVID. And then you can see that really COVID takes about, 27% of those expenses. But I also want to mention that in personnel, we also have COVID expenditures that people that are assigned to work in COVID that we were not able to just isolate in here. So there's a little mixture in between those. So I just wanted to give you a little impact of 27 plus part of this 58 in here. Our next slide is, it's all about COVID. So this is just an example of what really, or where money in COVID is going for. So our biggest expenditure is basically containment, which is at 39%. And then we are counting our testing and vaccination to be the next two categories. So this is where all the money, the 6.4 million that we've set aside is going towards. And 75% of all these expenses are applied to personnel. And we've hired about 65 people just to work strictly on COVID, which work in all these areas or categories for COVID.
Marielle, can I ask a quick question about the vaccination number? Is that in ramping up for COVID vaccines, or is that pushing, for instance, flu vaccines?
That is ramping the COVID vaccine. So we've worked with Indra to estimate what are the future cost of setting up and in additional staffing that they'll need to implement the vaccinations.
Thank you.
You're welcome. And this is a little quick example of where our staff changes are. And you can see here that we've hired 65 COVID related positions that are taking part of those $6.4 million. The other change was in our environmental health. And as you know, PACE and KCP moved to Oscar in the county back in March. And the only other change was a WIC restructure. And even though it looks like we've increased FTE here, what really happened was that the WIC program had, a lot of staff, but they were all 0.5, 0.75. And unfortunately, because of flat funding, some of those positions got eliminated, and some of those positions were given a full FTE. But it's not that they actually received additional FTEs. It was more that we got rid of some of the weird point FTEs to make complete FTEs. So that's really a picture of what happened in 2020 to 21, which is greatly just COVID hires. And this is our unassigned fund balance. So this is a really picture that tells us, this is where we were before we allocated our money and gave COVID all that help. And this is where we're going to be at after we give COVID all that additional money. And that gave us a 6.7% of our total fund balance. So once again, this pictures what the county in that additional savings we were able to carry over and fund all those COVID salaries and positions that we needed. And this is just kind of like a more detailed example of the prior slide. And it just tells you where we were in the beginning. So in January 21, this is how much we kind of carried over. This is, the examples that we have of carrying over a little bit of $4 million, from that spending all of our operating and then a little bit of excess from DOLA, which the county was part of. These are some of our restricted, which these are kind of like mandatory and we really don't change. Then we follow under the restricted fund balance. So one key point to highlight is that this committed emergency preparedness contingency number used to be $200,000. And because of COVID, that was one of the changes that Jeff suggested that we move to $500,000. The $100,000 are just items that we haven't prepaid our equipment that we aren't able to spend. And this is where we get to that number on the prior slide. That's how much money we've had to begin with, and then after allocating all those expenses to cover, this is where we end up, which is the $1.1 million. And then it just shows you the pictures of we end up with a balance that is at a 6.7%.
Hey, Marielle, can I add a couple things here?
Of course.
So just wanted to talk a little bit more. So what we're doing, as you'll see, is we are proposing to expense down to 6.7%, which is a little more than we've expensed in the past as we've come to you. And we're making some assumptions with that. Some of the assumptions that we're making with that are that we are going to be able to, we're going to have to do the majority of our COVID work. So the real hard push for us is going to be in 2021. And we expect that although we know COVID will not be completely gone at the end of 2021, we expect that we will be in a very different place in terms of the number of cases that we have that are in the community. We still may have some outbreaks that occur after vaccine is dispersed, as you heard Indira talk about. We don't know for sure if 75% herd immunity is going to be effective or if it's going to have to be higher or lower than that. We're going to have to see how some of that plays out. We also don't know exactly how long that vaccine will protect us for. So some of those things are assumptions that we're making, but we're making those assumptions still with the intention that the majority of our work is going to need to happen early on in 2021 and carry through 2021. But that by 2022, some of that work is not going to be needed at the same level that we're investing in now. So the reason we bumped that to 500,000 is because the majority of our expenses here are allocated for 2021, and that's when we are going to expend them. And again, just want to say really clearly that without us being able to get reimbursed by those funds from DOLA for the expenses we already had, we wouldn't be able to carry a reserve this high. We wouldn't be able to hire all those positions that we had on that previous spreadsheet. So those are key pieces for us, but that's one of the reasons why we bumped this to 500,000, because we don't know exactly what's going to happen in 2022. And we feel like carrying a higher reserve rather than a lower reserve going into some of those unknowns is going to be important as we move forward. So just wanted to add those few things on this slide here. Thanks, Marielle.
This is Megan. Marielle, I just got a couple small things to add. This has been an interesting year, and back in the April-May timeframe, we had no idea what funding was going to look like. As we headed into June, we were made aware of the ELC. The CARES Act was kind of up in the air whether or not we were going to be able to be reimbursed for some of that. But I just want to say that Marielle, as well as Melissa Golden on our accounting team, have diligently been tracking all the different grants and funding that have come available to public health this year, and just like been the most proficient at moving things around and making sure that it's correct, and that anything that comes up that we address right away to ensure that public health could start to ramp up as funding came in over the last few months, and then that we were stable in 2021. There was quite a few unknowns there for a while, and so I think when we came to you in September, we had no idea about DOLA, and some of the others were still up in the air. But we're pleased with where everything is. Just even in the last couple of weeks, we've found out and are excited to support public health and all the resources needed to do the work next year.
Thank you, Megan. So I'll move us to the next slide. And this is a screenshot of where that reserve is. So at a 6.7, we're at a 17 million. And then this just tells you if you spend so much, this is where our reserve will land at. So this is really a good picture of letting you how much can we or we cannot spend to maintain us where we need to be at.
Hey, Marielle, just one more quick thing for this slide too. Just a reminder for the board that our policy is to not go below a 5% reserve. So you can see that that would be about a $250,000 expense if everything works out exactly as we've assumed in these scenarios, which we of course know that it doesn't. And we typically would not, we haven't spent down that low for quite some time at this point. But I just wanted to remind board members, especially new ones, that our base is a 5% in terms of reserve.
And I think another thing to point out with this is, you know, having conversations with our division managers and our management team, and just kind of talking through next year. I think everyone is committed to a continuous analysis of what the 2021 budget is going to look like. The numbers that Marielle has presented tonight, that's where we're at today. Those can shift very, very quickly in a positive or a negative manner. And so just being aware as leaders and being good stewards, it's just our job to continuously look at what is needed and ensure that we continue to shift the COVID resources over the next year to make sure that that we're able to continue the work as best as possible with the funding that we've already received.
Thank you. The next slide is just any questions that might be available by anybody.
Hi, Marielle. This is Greg. So
Hi, Greg.
You just started this year, right?
It's been quite the year. I'm
Wow.
excited, thrilled, and you know, we just go with the flow.
No, I'm very impressed. Your mastery of and command of the various funding, revenue, expense pots. Very impressed. Thank you very much.
Thank you.
Yeah, thank you, Marielle, for your work on this presentation, and thanks, Megan, for all that you have done. And I'm reflecting on what a privilege we have in Boulder County to even have the ability to dip into reserve funding. So I mean, it really shows some really strong financial management over the years, and again, just how fortunate we are in this county to be able to move resources and to have reserve funding to dip into, because I venture to guess that is not true of so many other places that are struggling with the same pandemic that we are. So so thanks for all of the work. Thanks for the years of sound financial planning to public health, and just reflecting on our privilege here.
I agree. Thanks, Morgan.
Okay, looks like there's no other questions, so I'll hand that over to Jeff.
Thank you, Marielle.
Thank you.
Yeah, thank you so much, Marielle. And Greg, I totally share those sentiments. You know, we don't have an easy budget at all. It's complex, lots of different funding sources, and Marielle has just done an incredible job. So I want to thank Marielle and especially Megan, who is really, as you've seen, really brought us leaps and bounds forward as we've moved through all this process. Again, complex budget, trying to figure out how to sustain this budget so that we can keep the most critical things funded and do it in a way that carries us through the greatest amount of work. And I just really appreciative of both Marielle and Megan. So thank you both. So if the board doesn't have any questions, what we need from you is a motion to approve the budget. And I think that takes us to a closure of this item.
This is Brooke.
Okay.
I move to approve the 2021 budget.
Can you read the resolution,
Oh, sorry.
Brooke?
Is it resolution? I move to approve resolution 2020-06, adopting the 2021 approved budget.
This is Landry, I second.
Okay, we have a motion and a second. Looks like we had a lot of conversation on this already. So, all in favor?
Aye.
Okay, motion carries. Thank you, team.
All right, what I want to just let you know is that what we'll do, as we have done in the past too, is we will come to you with an amendment once we actually close the books, so we can shore up what our actual budget looks like going into 2022 after those books close. I want to again take the time to thank Ramona, who hung with us through the meeting tonight. Thank you, and I really appreciate every single year when we have the county here with us, sharing what data they have relative to the budget and how it relates to ours, and just the partnership that we've had with them over the years has been wonderful. So Ramona, thank you for being here. Thanks for presenting. And again, appreciate everything you've been doing.
Oh, we're really glad to be here, Jeff. It's a good partnership.
Great, thank you. All right, Greg, I'll turn it back to you.
Okay, thank you. And we will, let's see, next up on the agenda is the item 6, which is the director's report. I know this was a pretty long budget meeting. We had a lot of activity. Are there any burning questions on things in the director's report? Let's see. I just think I had a quick one, Jeff. So with the case investigations, right? The initial positive case, and just reading some of the notes about how many cases we were able to handle, and it's been about a month and a half of not being able to get to all of them. So if the dial drops back to orange, would that still be too high of a caseload for case investigations to be fully completed?
So I'll start, and then I'm going to ask Indira to jump in. So when we first were working to target the number of staff that we need, we were working based on the Protect Our Neighbor target, which was, I think this is it, 85% of our cases investigated within 24 hours. And at that level, we would have need to had, I think it was 28 total staff to do 50 cases, if I'm not mistaken, or maybe it was 24, somewhere in that range. So we're at an average right now of 21 or 121 new cases per 5. So we're above double that right now, but we also are bringing on new staff. So I'm going to see if Indira has a sense of, with the new staff that we're talking about bringing on, what does that actually look like in terms of our capacity to be able to respond and follow up?
Yeah, it's kind of complicated because this past year, the state system, which is known as CEDARS, that system has been in place for a long time, at least 15 years, but it was a data collection system that was really not designed for a pandemic. And so we were having to kind of duct tape pieces together with our data collection. So it was taking our case investigations a lot longer to handle all those cases. In addition to that, we had staffing issues. They were estimating as a certain amount of time that you could do, one case, and then you would handle all the contacts within the household. And we didn't have the resource coordination. So as the resource coordination gets built out, and we actually have a place the case investigators have someone to send the case management components of their job to, that will allow them to streamline. So I would estimate, given the new staff, given the new Dr. Justina system that launched, that's still being built out by the state, that we should be able to handle at least roughly, at least 75 cases with the staff up to 100. But just keep in mind also that we have a dedicated teams to long-term care facilities. That's all they focus on. We have dedicated teams to K through 12. So when schools go back, open back up, we have case investigations that are, focused just on K through 12. And we have another one for early child care centers, just to keep those moving, because we know that those are kind of our priority groups that are really important to parents and to our community. So we are building out the other kind of general case investigators. And we have one whole team that's dedicated to outbreaks and outbreak management. And we've been very, knock on wood, we've been very successful with the jail, with the COVID Recovery Center being built, and the shelters. And so we have, we kind of have this approach that we need to focus on those where the high priority areas are. And then we have general case investigators. So I do think that as the numbers come down, we'll be able to handle most of those cases, but it's hard for me to give an estimate about how many exactly. But I think once the resource coordination comes on, I think we're going to be in good shape in January. Sorry, Greg. That's a long-winded way of answering your question.
Not a very easy question, and obviously not a very easy answer either, but thank you.
We should probably have more information by January about how many cases we can handle. So, and just remember also, we work 7 days a week. So that means that, you have all these case investigators, but there are teams that are just dedicated to the weekends too.
Yep. Wow. Any other questions on the director's report? Okay. Thank you, Jeff and team, for putting that together. And we are going back to the agenda, which should just be old and new business. Jeff, do you have anything you need to update us on?
I do, and you probably all saw the message that I sent out on Friday. I hope you all received that. I can't check to double check who all I included because I blind copied it. But I hope you're aware that I am is with both great sadness and also excitement for Megan Hatton that she is going to take a new position as of January 4th. Megan is going to be moving over to the University of Colorado, and she's actually going to be the director of COVID operations for CU. So we are very sad to lose Megan. As you all know, Megan has worked, she's just done incredible work for us, not just in the budget and finance area, which we all know she's been wonderful at, and we're going to greatly miss her in. But she's really taken such a strong leadership role throughout this COVID response. Megan's been incredible. She jumped in and supported our incident command system. She's been supporting our area command system. She's been taking a strong role in liaison with the University of Colorado, and it's clear that they saw her great level of work, and that she now has a position that's actually going to benefit Boulder County Public Health quite a bit, because Megan, in her new role as the public health COVID director, is going to allow us to have a close connection with CU, but somebody will be there on the inside that actually understands really well how public health works. So the continued linkage to Megan in that manner makes me very happy. I was very sad to hear that we weren't going to have Megan in public health directly anymore, but I'm also very excited for the fact that we are going to continue to have an even stronger relationship with the University of Colorado moving forward, because we'll have Megan there as a liaison role between CU and us, and Megan will be able to relate the kinds of things that we do in public health, and it will help us as we move forward, especially into this next year. So very sad to see Megan go. We do have a transition plan in place. Marielle has agreed to be our interim director. I want to thank Marielle for her willingness to do that. We also have a transition plan where we're going to bring in some hourly staff to support admin. Megan is also, thank you, Megan, so much. I can't tell you how much this means to me. Megan has agreed to remain on an hourly position. So if we need help and support, she's willing to be there for us. And that alone in itself just demonstrates Megan's integrity in this process to make sure that she's doing everything for us in public health to make sure this is as smooth as possible. So I'll stop there and let Megan add anything else that she wants to add at this point and see if the board has any questions. We can give you more detail on the transition plan at a later date, but just wanted to make sure you're all aware of that.
Hi, everyone. For me, this is really about Marielle. I am so excited for Marielle and this opportunity for you all to get to work with her. She has been the lead of my ghost team for the last year, and she has made sure that that this agency is where it's at today. If she hadn't been here and hadn't stepped up like she did, without really being asked and just offering with a grace and a smile, like so many days, I wouldn't have been able to really support Jeff and any of the COVID work this year like I did. So I am forever grateful to her, and I wholeheartedly am excited to transition this to her. And I think that you all, I'm excited for you all to get to see her and work with her one-on-one, and watch her transition to become the face of admin moving forward. So thank you, Marielle, for everything this year. Oh, now I'm gonna cry.
Yeah.
So I'm sorry. So I just want everyone to know that she is where it's at. She is the future of this work, and thank you for everything the last 3 years. Obviously, this opportunity would have never came about had I not come and worked for Boulder County Public Health. So it was a hard decision, and I'm going to miss all the people. And I'm still stuck with COVID work, so it's not going away, Jeff. But I'm excited to be able to work with everyone just in a different capacity moving forward. Yeah. So again, thank you, Marielle, for everything this year.
Thank you, Megan. Yeah, I don't want to talk much because I don't want to cry. So I just say thank you.
And I also have to just say thank you to Jeff. So it has been a pleasure working for you, Jeff. I can't say enough about the person that you are. I've worked for a lot of people, and you just see the good in everyone. And you're just a really great human being, and you care about others, and that means a lot to me. So just thank you for everything for the last few years.
Thank you, Megan.
Well, thank you, Megan, for your hard work over the last few years, and good luck on the new role. Keep them kids and keep those 18 to 22 line down, okay?
I'm gonna try my best. So, thank you.
And then when is your last day, Megan?
So it will be after the holidays. So the beginning of January, I'll make the transition.
Okay, maybe we can touch base offline and talk about what's going to happen with the director search.
Absolutely. You're on my to-do list, Greg.
Okay, awesome. Thank you. Any other new business? Any of the board members? Okay, well, seeing none, that was a 2.5 hour board meeting, one of our longer meetings, but with the budget and with all of the COVID work. It's understandable. So thanks again to everyone on the public health team. Great attendance. Thanks for sticking with us for that long. And we will talk soon. This meeting is adjourned at 8:01 p.m.
Thank you.
Thanks, Greg. Thanks, board members.
Thanks. Bye.
Thanks, everyone.